This is the coolest thing I've ever done.
Cool, huh?
What you see through this, I wish you could record it.
Yeah, right? Trippy, huh?
Super cool, yeah.
Hello, I'm Dr. William Wiley. We're about to go into a case with Mary Jo, and she has a history of a high prescription. She's farsighted and a lot of astigmatism. And what that means is her eye is shaped a little bit more like a football. It's not perfectly round, coupled with being very farsighted. She came in to see us for LASIK eye surgery, and it turns out her prescription was beyond the range that we can successfully treat with LASIK. So what we decided to do, and what we thought was best for Mary Jo, was to... We're going to basically, remove your natural lens, and then put a new lens in that has your glasses prescription built into it.
Right.
As you know, you have a lot of farsightedness and astigmatism.
And astigmatism.
And so we have a lens that can correct those two things. What this will allow her to see is distance vision with very high quality. We also have the very newest lens, which has some ability to give distance and intermediate vision to kind of give her some depth of focus. And that will give her high quality vision to allow her to function with most things without glasses.
I have been waiting almost 50 years, actually 50 years, to have this done. So I was so glad when I found out that this is something they could do for someone with my prescription. So I am so excited.
Any questions for me?
One question. It is possible in the future, should my vision start to worsen, I was not a candidate for LASIK surgery.
Good question. Yeah. So basically, right now your prescription is so extreme that you're not a candidate for LASIK. Once we replace the lens, we'll normalize the prescription. And then for some reason, if you end up developing a small prescription over time, just through natural sort of eye changes that can occur, that would be rare, but it's possible.
Yeah.
If that were the case, we could do LASIK on now that small prescription.
That makes me happy.
Yeah, so you're starting off with a prescription like this,
Right.
too hard to treat with LASIK,
Right.
but we'll reduce it somewhere around 0. If you have a small prescription in this range, we could do LASIK to fine tune it.
That's awesome.
Yeah.
Okay.
Okay.
That makes me happy.
So this is a case where we're sort of not doing LASIK or traditional laser eye surgery, but going more for lens surgery to achieve our goals. So we're going to walk in. She's allowed us to video the procedure, and I'll walk you through the case and what we're doing throughout the case.
Hello, bartender.
Welcome. Are you Mary Jo Williams?
I am.
Anesthesia-wise, this is always my same spiel.
Okay.
We do not go to sleep for the procedure.
All right.
And the reason we don't go to sleep, this is that one procedure that you have done where I need a little bit of cooperation from you.
Okay.
Colonoscopies and things, I don't care which way your eyeball's looking. Today I do care.
Yeah. Okay.
So basically what we do is we're aiming for comfortable but cooperative.
Okay.
So able to look up at a light bulb,
Yeah.
just a little more drunk, don't care so much that you have to look at that light bulb.
Okay.
Way we like to do it, start off with that pill underneath your tongue.
Yeah.
Does not taste good.
Okay.
It is lemon flavored. It does get a little bitter, I'm very honest with people, but it is a fabulous drug to kind of take that adrenaline level.
What's it called?
It's an MKO melt, so it's midazolam, ketamine, and Zofran. So a pain medicine, an anti-nausea medicine, and a relaxing medicine.
Makes me happy already.
Makes you just not care so much about what's going on. We're in the hallway right in front of it. Here we go. This is the operating room.
Oh, how nice.
Do a timeout. Mary Jo Williams, driving, clear lens exchange, right eye. Lens to be determined.
Has she received 2.5 copies?
Okay, so we'll place small incisions so we can place some numbing drops inside the eye. You'll feel some like tears and fluid here, okay?
Those lights are so pretty. This is so cool.
Isn't that neat?
Did you ever have this done to yourself?
Well, I had what's called radiokeratotomy, which is like it's like the original Russian version of refractive surgery. This is some fluid just to get the lens all freed up. Now we're going to use some ultrasound that kind of dissolves the natural lens.
Now, when the new lens comes in, do you think this will last the remainder of my life?
Yeah.
Okay.
So basically the new lens, we'd expect it to last a lifetime. We put it in babies and it would last for 100 years, assuming they live long enough.
Okay. What's it doing now? Breaking up?
Yeah, breaking up.
How do you get that to do it?
It's basically just sound waves.
Anyone ever had a rejection of the new lens?
No, the new lens is very inert, so the body doesn't want to reject it. It really doesn't know it's there. It's probably even more inert than your natural lens.
Okay.
So what we're going to do is we're going to use a device that's going to measure your eye and tell us exactly which lens to place. It's called Aura intraoperative aberrometry. And it's going to take a measurement. We've come into the operating room with about 15 different lenses. And it's going to guide us on which lens is the perfect lens for your eye. Okay? Let's go with a 525, 27.5, 525.
27.5, 525.
Okay. So we're getting all keyed up here. Now I've got the lens. It comes in a little injector cartridge. I'm going to load that in, advance it, and now there's guidance. It's sort of like a video overlay. I'm using 3D glasses to see the video overlay in 3D, and it tells me exactly how to position this new lens. So I'm using this guidance to guide me in the positioning of this new lens. We're getting it nice in position. How you doing? How you feeling? Okay?
Yeah, this is neat.
Cool, huh?
What I'm seeing looks really neat.
Beautiful. So now there's little marks on the lens that indicate exactly how to position the lens. So we've got these marks here and marks there to overlay on the axis marker. So we'll get it positioned, and then we'll take a measurement to assure that we've got the proper lens in the proper position. Okay?
What's the lens made out of?
It's acrylic. It's kind of like plexiglass.
Oh.
Just making a little incision to kind of help with some of the astigmatism.
Thank you.
You're welcome. So it tells us the lens is in perfect position. We've got it perfectly rotated and everything looks beautiful. We'll take one more measurement. Beautiful. Capture. Went perfect, okay? You did awesome. That eye's all done. That wasn't too bad, was it?
I'm happy.
All right, you're halfway through. She did perfect, so we were able to take the natural lens out and then use a machine called Aura to pick the proper lens, place the proper lens, and then adjust it to assure that we've treated the prescription right on target. So we're halfway through. We've done her first eye, and now we're going to get her set up to have the second eye to complete both eyes today. Yep, so now we've started the second eye and we're getting everything prepared and set up to begin the procedure. Placing incisions to gain access to the eye so we can remove the clear lens and then replace the clear lens with a artificial lens that has a glasses prescription ground into it. It's the latest generation of artificial lens that is to give distance vision with some extended depth of focus. I'm using ultrasound to dissolve the natural lens. Look down a little bit. Now look right at the light there. A little pressure here. So we're able to remove that was the clear lens coming out. Now we're just going to kind of polish the internal side of the bag that is going to hold a new lens, okay?
Sounds good.
Sounds good to you?
I'm comfortable.
Good. What do you think about those little pills with the medication in them?
They're my new best friends.
Right? I'm just getting everything prepared. We're about to use Aura again. That's going to pick the new lens. It's going to, now that we've got the old lens out, we can take measurements and get a very precise reading on what the new lens power should be. So it's going to give us that information in a moment here. Capture. Okay. So now it's told us which lens to use. Get ready to place that new lens in.
I use 627.5.
And so the lens comes preloaded in the cartridge system that allows us to lubricate the lens, and then it's self-folding. So it's like a contact lens that's self-folding that is injected inside the eye. So it's got a little injection system that sort of dials this lens into position. Again, we're going to use the guidance to kind of tell us exactly how to position this lens. So here's the lens folded up, getting injected inside the eye. And there it goes, all folded into the eye. Then I use a little tool to position it. Then it unfolds into the position. There's a video overlay with eye tracking that tells us exactly how to position this lens to make sure we're maximizing the outcome. Now look right at that little light there.
Yeah.
It's telling us to rotate the lens clockwise a little bit. So that's what we'll do. Again, it's giving us some directions to kind of rotate the lens to perfect position so it maximizes your final result. Now look right at that little light there.
Yeah.
Capture. So now it says no rotation recommended, so it says we've got the lens in the proper spot, okay? And that's it.
I'm done.
Nice job. Yep, all done. Keep coming on.
I'm happy.
Oh, good. So we're all through. Mary Jo did perfect. We took her natural lens out that had a large prescription, and we replaced it with a new lens that contains her glasses prescription to allow her to kind of rehabilitate her vision, to give her some great functional distance and intermediate vision, and I expect she'll do fantastic.
Here we are. Woo-woo. HEKPC. I'm doing good. Bang.
See ya.
You
How was
too.
your week?
It's been good so far.
Good so far?
Yeah.
Good. Enjoying your new vision?
Yeah.
All right.
I am so happy. I just keep
I
saying
know.
it
Continue with the eye drops though once a day
until they're gone.
until they're gone.
Okay.
How are you reading up close, okay?
Perfect.
Good, good. How's driving?
Awesome.
Wow.
I can't believe it. I'm not gonna. When I wake up in the morning
Yeah.
and I can see the clock and I can look, my phone. I'm looking around and going, and I'm happy all over again.
Yeah.
Like the day of my surgery.
Right.
Because it's like I said, 55 and a half years of this and not being able to see.
Yeah, it's a fantastic procedure, isn't it?
Yeah, I'm really
I know
thankful.
I know your eyes were terrible,
They were terrible.
and it turned out awesome. I mean, you had trouble with, you couldn't wear contacts all that good.
No.
And with glasses on, it wasn't as good either.
Glasses were actually worse than wearing the
Right.
contacts.
Plus now you can see both distance and near,
Yeah,
and it's good.
it's fantastic. And I mean, I can't say enough good things about you doctors here and how wonderful this experience has been.
You make my day.
I'm serious.
I know.
I love you guys. If you've been putting it off, having this surgery, or you have any questions, there's videos, obviously, that you can look at. But there's nothing to be afraid of. I strongly encourage anyone who's thinking about it to have this done. And I can't believe I waited this long. I'm 55. I've been reading about it forever, years and years and years, like 20 years since. But don't put it off. Do it now. Do it now. It's worth it. I'm so happy. I can wake up and see. Very happy.